Well, I train people about peak performance, stem cell therapy, bioidentical hormones, nutritional approaches, and the power of the mind. We put it all together so that people can live the absolute best quality of life. Well, the disease AIDS, if you look at the literature and the research, Dr. Peter Duesberg from UC Berkeley did a lot of work in this area, and there's quite a bit of evidence that prescription drugs and over-the-counter drugs and street drugs suppress the immune system. So my first concern is, let's really look at the whole lifestyle of the individual. Let's not blame AIDS only on a sexually transmitted disease. There's probably quite a bit more involved. If you look at in Africa, where there's a high degree of AIDS, but it's related oftentimes to starvation and kwashiorkor, and these people have the problem, mashermore as well, which is a calorie deficiency. They've never tested the people for AIDS. They just assume they have it because they have certain symptoms. But the reality is that in Europe, when there's a decrease in the use of recreational drugs, amyl nitrates and so forth, and these people were no longer having suppressed immune systems, the rate of AIDS dropped dramatically in those areas where the drug use had dropped as well. I think it's correlated more to lifestyle, and I think that if we build up the immune system and we take the right approach, that the disease AIDS is probably something that we all have present in certain, just like we have strains of various bacteria, the body becomes overwhelmed when we suppress the immune system due to drug use and some faulty lifestyle approaches. With cancer, there's many diseases related to cancer. There's blood-borne diseases, there's organ diseases, and cancer often resides in people who have low oxygen levels. So you have to follow a program that oxygenates the body, delivers maximum nutrients, and stimulates the immune system. All that can be done, and oftentimes complementary medicine are starting to look at how can you do something to above and beyond just radiation and chemotherapy, and I think there are some wonderful solutions for people who have cancer that want to look at this approach as a complementary approach.